Welcome to Fair in Medicine's webinar. We are continuing our series on gender medicine, and so we're thankful to have you guys join. We're grateful to have you guys join us today, talking about an urgent conversation that needs to be had with gender in schools using Restore Childhood's new toolkit that's titled An Urgent Conversation. I have today, I'm really excited to have the panelists that we have on today talking about this toolkit and introducing it to you. Originally, if you signed up for the webinar, you thought Natalia was actually going to be here, but Dana's going to be here instead. Miss Dana Hensley. She's a mother and also an advocate for children's health and well-being. She helped co-found Restore Childhood with Natalia in order to help restore normal childhood to children during COVID-19. And so the both of them really thought that this toolkit was necessary. So that's why we're here. And Dr. Christopher Kalibi, who you guys met at our last gender webinar. He is a professor of psychiatry at the University of South Florida in Tampa. He's board certified in psychiatry, child and adolescent, and forensic psychiatry. And he's a distinguished fellow at the American Academy of Child and Adolescent Psychiatry. Dr. Kristen Walsh is a board certified pediatrician in Northern New Jersey. She's a mother and has been involved in early childhood advocacy on both the state and the national levels. And I got the opportunity to work with Dr. Walsh in Urgency of Normal. So excited to have her here. Everyone here has been a contributor of the toolkit, just so you know. So we are really treated today. January Littlejohn is a senior fellow for Do No Harm. Thanks, Do No Harm, for loaning her to us today. And she is primarily focused on the harms of gender-affirming care. She has a background in mental health counseling, is a wife and a mother of a 13-year-old daughter who was socially transitioned at her public middle school without her knowledge or consent. So it's going to be exciting to hear her share her story. So thank you all again for attending. Please share this with people so that more people can join, because this is an important conversation we have. So let us let everybody know that Fair in Medicine is continuing with our discussions about gender medicine. So let's start. The first thing I want to ask the panelists is, why is this conversation urgent, and what makes this toolkit necessary when there are other gender toolkits out there? So I'm going to start with Dana.
Hi. As Nikki said, I'm the co-founder of Restore Childhood, and I'm a mom of 4. I got involved in child advocacy. I've been involved really throughout all of my mothering, but got really involved during COVID. And it became apparent that the experts really didn't know what they were talking about. And as time has proved, they were wrong in a lot of ways, and it damaged our kids. And people just kind of piled on to these ideas that what they advocated, to close schools or to mask kids forever, that was necessary and the kids would be fine and it wouldn't bother them, it wouldn't hurt them at all. The same thing has happened with gender ideology in schools. Over the years, I would say over the past 5 years, things have really accelerated at a rate that is really scary. How much gender ideology is talked about in school, how much sexualization of children happens in school. You know, the ages of my kids range from 7 to 16. When my 16-year-old was in 6th grade, she was a normal 6th grader. Like, she was just finishing up playing with American Girl dolls. I now have another daughter that just finished 6th grade, and she didn't want to go to school for the entire month of June because she hated how much pushing they had of transgender stuff and flags and everything that just infiltrated her daily life. And it was very uncomfortable for her. That didn't exist when my 16-year-old was 11. So just 5 years ago, it was more if you're gay, that's fine. We're just gonna kind of move on and celebrate that in Pride Month. And it really wasn't an issue. But now it's in every single class, it's in every single school. And there's really not a lot that you can do to even have a conversation with somebody about the fact that this might not be right. So when we were talking, this took us about a year or so to really complete. We realized that we needed to be able to show the data and the information to parents so that they understood how terrible this would be for a school to keep secrets from parents, privately socially transition their child, and basically put them on a one-way pathway to a medicalized pharmacological future for the rest of their lives. They will always be a patient of the medical establishment. They will always be on some kind of medication, and these medications and these medical surgeries and interventions will impact them for the rest of their lives. So
So
that's why
Dana,
we created the kit.
Let's go back and talk about what you were actually seeing in school now compared to 5 years ago. So what is your daughter experiencing? You said that she says it's all over all over the place. So what's actually happening are that bothers her or makes her really uncomfortable?
Well, my 11-year-old can tell you every single flag, every sexual orientation flag that there is, and what all of those things mean.
Okay. And is
We're at a
that
point
something?
where I would have to Google what some of those words actually are. I don't know what that means. I
Yeah.
didn't know what pansexual means. When my 16-year-old was in the same exact school 5 years ago, she didn't know any of that. And my kids are pretty sequestered as far as technology goes. They don't get a smartphone until they're in high school and they prove that they're able to do that. So you can't blame my kids on getting information from
Ah,
elsewhere. Like this is
okay.
happening at school. It's conversations that are happening at school. It's posters that are at school. It's what teachers are teaching.
Okay. Okay. That's the thing. So are teachers teaching that, like all of those, the different stripes on the on the pride flag, or I mean, are her peers talking about it and getting it from there, or is it just really or is it, notices from the school or meetings
I
that they have?
know in our school district, as far as I am aware, and I could be wrong, there is no actual um, curriculum that is being taught about gender. However, 5, 6 miles down the road, there was an incident of a child that got a quiz in health class and she got the answer wrong because she didn't
Mhm.
answer about is gender assigned at birth or not.
Got it.
And the mother
Okay.
kind of went viral talking about that.
Okay, okay, yes, so that's important. I think people need to like to hear like these specific stories here. January, I'm excited to hear your story because your family was affected by school policy on gender. So I would love to hear tell us her story and tell us why you think this toolkit is necessary.
Sure. Well, thank you all so much for having me today. At the height of COVID in 2020, our daughter was 13 at the time, and she came to us and told us she no longer felt like a girl. And this was shortly after three of her in-person friends at her local middle school had also started identifying as some form of transgender. And as Dana touched on, if you look on page 12, toolkit, when we think of the word transgender, it no longer just means kids being confused or being, experiencing distress of their sex and identifying as the opposite sex. As Dana mentioned, today we have over 72 gender identities that are being marketed directly to children. And they're being taught that they can choose their gender, that it's completely separate from their sex, and that it's an internal feeling that only they know. They can choose to be a boy, a girl, neither, or both. And this, gender unicorn and the genderbug person graphic right there is just a perfect example of how they are perpetuating and creating this confusion in our schools with our children. And so when our daughter came to us, we were completely thrown off guard. She had experienced no distress in early childhood over her sex. There had been no signs or symptoms. And so we elicited the help of a mental health counselor. I am also a mental health counselor, but when I was trained in counseling in the field back in the late 90s, early 2000s, this issue was non-existent. It was so incredibly rare, and words like non-binary weren't even being used. And so my husband and I were just really struggling to understand not only what was happening with our daughter, how there was a group of children at her middle school that was collectively coming out as some form of this trans identification. So it started to really escalate that summer, Nikki, and I, like many times, had gone to a teacher. And because we were not allowed on school campus, it was a very different, school experience that year in the fall of 2020. But I explained to a teacher what was happening with our daughter, that I felt like this was directly related to her friend group, that we had sought counseling, and that we were not using the name and pronouns that she was requesting to go by. A couple of weeks later, my daughter got into the car, and let me just say the reason I told her that is because I saw the school as a partner. I naively thought that they would treat this like a nickname. And so my daughter got into the car a couple of weeks after school started and said, "Mom, I had a meeting today about my name, and they asked me which restroom I wanted to use." I was completely floored. I was very confused and shocked. Number one, how they would have a meeting alone with my child who was 13. Emotionally, she was only 11. She has a 504 plan on file for ADHD. And so I was just really struggling to understand. So I immediately emailed the guidance counselor and asked her about the meeting they had with my child, that I thought it was a safety issue. She was asking my daughter, who she knows is a female, which restroom she wants to use. And I was just really confused about the whole thing. Well, I was called back with the guidance counselor and the assistant principal and was told they could not give me any information about the meeting they had with my child, that she was now protected by a non-discrimination law. And my only recourse was to then go to the assistant superintendent, which I did, and we conversed with her back and forth for almost 7 weeks. It took that long to get an in-person meeting with the middle school principal, and we were shown the transition plan that they had completed with our daughter, the social transition plan, which was a 6-page document. You can look it up. It's online from a company called Gender Spectrum. And this was not just about name and pronouns. They asked her which restroom and locker room she preferred to use, which sex she preferred to room with on overnight field trips. And then within this plan, they asked the children, how should we refer to you when speaking to your parents? Should we use your birth name and pronouns, or the name that you're—
Wait a minute, go back. They asked her which sex she would prefer to be with on a school field trip.
Correct. Just, think about that power differential. My daughter was 13, emotionally 11, which the school knew that. She was alone in a room with 3 adults. There was the guidance counselor, the assistant principal, and a social worker I had never met. Being asked questions that would have absolutely impacted her safety. And my daughter was not mature enough to understand the danger that these kind of questions posed.
Yeah.
And so the only question that was asked in these plans, which we learned very quickly that what happened to our family was not an isolated incident. These plans were being implemented not only all over Florida, all over the nation. But the only question they ask the minor child is, are your parents supportive? And that one question alone determines whether or not parents are cut out of these social transitions occurring in school. But many parents aren't even aware because of that last question that I referenced. So they'll if the child chooses for the school to use their birth name and pronouns when speaking to parents and parent communication, there have been instances where a child was living a double life for months. Everybody knew that this child was struggling, experiencing distress over their sex, except for the people charged with caring for that child's emotional and physical well-being, which are their parents.
Yep.
So that's really why this toolkit is so critical, because there is a lot of misinformation and frankly flat out lies about what this is and what is not. And parents, you know, from my standpoint, many of them have been just as much victims of this ideology as the children have been, because
Yeah.
they are not being given the whole truth and given all treatment options available. And so this toolkit it really is critical, because we are seeing still an explosion of young, predominantly girls, but we're also seeing this in boys, experiencing
Yeah.
this rapid distress over their sex, thinking their bodies are wrong, and thinking the only way to fix their pain is to irreversibly change their bodies.
Yeah. All right. So what I would like to really highlight is from both of your comments, excuse me, I don't know why, I just got this cough, that the information that's being presented in schools is targeting pretty much every age level. So when you pointed out the gingerbread and the gingerbread person and the gender unicorn, those are obviously, targeted to very young children. And so that's really important. And we do include that obviously in the toolkit. And in addition to that, I'm going to share this the other page here that's on this, just talking about what you're seeing at school. A lot of people may recognize the book I Am Jazz, where they introduce transgender topics in elementary school. So this isn't just happening at the middle school and high school level. And a lot of times they are just like the gingerbread person, or the gender unicorn. There's a gender snow person, and these are obviously illustrations that target very young children with coloring activities and friendly graphics, and very colorful, childlike graphics. So these things are happening at every level in school, and we include these examples in the toolkit. All right, so that's
Exactly
that.
right, Nikki.
Oh,
And it really varies depending upon state how this is being presented
correct.
in schools. In some states like New Jersey, California, Oregon, especially all the states out west, this is embedded into their K through 12 curriculum. But even
Yes.
here in Florida, prior to us passing the laws that we have now, it was, we had the gender unicorn being used in our human growth and development or sex ed. You have GSA clubs in middle school and high schools across the country which is really pushing this ideology. Social emotional learning is
Yes.
another vehicle for this ideology. Back in 2021, we had billboards or bulletin boards, excuse me, in our schools where they had all of this information up there with the flags that Dana was referencing. And these flags are very enticing to vulnerable girls that are looking for an identity. An identity crisis during adolescence, when your hormones are going crazy and most girls are already feeling uncomfortable with their bodies, to be sent the message that if you're experiencing discomfort with your body, it's because you're trans, is so terribly destructive. Not the message we should be sending our young girls, that they need to irreversibly change their bodies or to love themselves.
So for any of the audience members, I just want to point out, I forgot to actually tell you where you could find and download the toolkit. It's at gendertoolkit.com. You actually click on the link, download toolkit, and it'll ask you to enter your name and your email address. and they will then we'll send you a PDF file that you can download to have at your fingertips this toolkit. And so if you look at the page that we were just showing you with the unicorn, the gingerbread person, you'll find a lot of confirmation for what January was just talking about with how these topics are introduced into the school system. So a lot of them are related to policies that are in the social emotional learning curriculum. They want to create a safe environment, a non-discriminatory environment. Most of these ideals and these policies and the curricula are actually created by advocacy organizations that are very much pro gender affirming, or they're activist groups that are really trying to get this information out there in the way that they want it addressed. So they have, yep, they have instituted policy through the Health and Human Services Office. The CDC uses language from GLSEN, and the National Council of Teachers of English's guidelines, they actually have a guidelines for affirming gender diversity through their ELA curriculum. So this stuff is it's embedded in the curriculum in multiple ways, and it's brought up by teachers in multiple ways and at different levels of K through 12 education. All right, so Dr. Walsh, you give me your take on this toolkit and why you think this toolkit's important from from a pediatrician's point of view.
Yeah, sure. I just want to add to what you guys were just saying that here in New Jersey, there was, even in this very deep blue state, there was like a proposed second grade gender curriculum that got leaked. And there was such a big kerfuffle even here that I think that they had to change it because I think it was, considered extreme by a lot of parents. And so I'm not sure that they were even able to implement that proposed curriculum because, even here, the parents were very upset about it. So I actually had a very similar journey to Dana, but from, a pediatric professional perspective. I found Restored Childhood, or they found me pretty much through the Urgency of Normal organization that started during COVID. That's where I met you too, Nikki. And I think what happened to me at that time was all of my advocacy has always been in the area of early childhood. And what I was seeing was just very sweeping measures that were being put in place, to my mind, without any forethought about how it would affect children in general and young children in particular, which is my wheelhouse. So I was very upset about that. I was like writing letters to the New York Times right off the bat in March 2020. And I would have to agree, I think, so, what I think happened with COVID is that there was definitely, professionally speaking, talking about my colleagues and other physicians, there was an element of sort of groupthink and panic and politics that all got swept together into this maelstrom of what to me turned out to be very damaging public health measures that were put into place. And unfortunately, I do see some parallels, in the area of care for children with gender dysphoria. And I think that it's very important as physicians that our medical guidelines be based on medical evidence. And I think it's very dangerous when we let our guidelines be influenced by things like politics or ideology. And I think that's the way that we even inadvertently do harm to a lot of children. So I have a lot of concerns about that. I know a lot of pediatricians who do. Some of them have left the American Academy of Pediatrics over those issues. Some of them, like me, are staying in, trying to make our voices heard. I've been an AAP member since I graduated residency in 2003. I've seen them do a ton of great stuff for kids. I can assure you that I mean, I know some of the past presidents. I know, speaking from the pediatrician's perspective, almost every pediatrician, to a person that I know, cares a lot about children. And I think we have to be very careful. I think it's very easy to speak in these terms of like trying to support kids. For example, when I was being trained and throughout all my early career, the way that we dealt with these issues was just sort of trying to sit with the child where they were, using preferred names and programs or pronouns for as long as the child desired. And that was less of an issue when there wasn't a huge push towards medicalization. And to me, that is the main problem here, So I used to feel very comfortable telling parents, oh, sure, little Johnny wants to be a girl for a while, wants to wear dresses, wants to play with dolls, like that's fine. But now I get very concerned because I think, their puberty blockers are being used in ways that they were not really necessarily designed for. And I think what's coming out now is that some of the harms from that we're seeing, like, apart from the kids who are always supposed to be using puberty blockers, which are the kids with diagnosed precocious puberty. And then it's a question of months, not years. It's very much under care of a pediatric endocrinologist. And, even then, we were all warned that there were still serious side effects from these medications. And now what I see is those side effects are being downplayed. No one wants to study them. Even with all that, it's come out that there's likely a decrease in 7 to 8 IQ points for most of these kids who are put on prolonged, puberty blocker medications for months to years. And not to mention, irreversible gender or sex changing surgeries on minors, which I think the mainstream media likes to say doesn't happen in this country. And the numbers say otherwise. It's happened to many thousands of kids. That's why there are, multiple lawsuits going on right now. And so I think we're in a place where we need to reassess things, professionally. We need to look at how did we get here? What are we recommending? Is there evidence for it? And unfortunately, I think, some of the inside baseball is coming out that it's really sort of a circular ideological thing where sort of guidelines are requested by interest groups. And then, the organization that's supposed to be scientific, but really looks like more activist, which is WPATH, is coming up with guidelines at the request of political, groups. And this is all such a bad deja vu for those of us advocating during COVID. We saw like teachers unions basically helping to write CDC policy about school closures, and that we were not using science and evidence, but sort of politics to come up with these policies. So I think this is a very bad trend in this country, especially. Yeah. I unfortunately think part of it's happening because we never took a good hard look at what happened during COVID and what we should have done differently. I think had we maybe done that, less of this muddying of the water would be happening. But, what I say to my colleagues get very upset when politicians pass regulations that, affect medical care for gender dysphoric youth. But my response to that is always, okay, but if we're using politics and ideology to come up with our guidelines, we are inviting politicians into the exam room, and that's just the way it is. So do you want them in or do you want them out?
That is a fantastic point. That really is. And I was going to bring that up too, is I think people who are opposed to restrictions or legal restrictions on the use of gender affirming medicines and treatments, and people who are wanting to are pro or against legislation that is more affirming and shielding kids from these restrictive practices are both really doing the same thing. They are interfering with the doctor-patient relationship, in addition to the parent child relationship, and that is not the answer. And I think the answer is to empower parents with this knowledge, and other health professionals too, because as you mentioned, pediatricians and doctors along the way, all the health professionals, we want to help our patients. We want to do the right thing. I think that there's very few people out there that, like, intentionally wanting to harm children. I don't personally know any, but there are many people who believe that gender affirming care is the right thing. And some of that is because of what they've been told. They're not challenging or looking at the evidence themselves. They are being taught from, someone who is more experienced than them, that that's the way to think. And the same thing is happening with parents. So parents are being told this from schools and from teachers. And then on the same line, there's educators who want to do the right thing as well. So there's lots of teachers out there who really care about kids, and they think they're doing the right thing, that they think that they're showing a lot of compassion and inclusion of children, when a lot of what they're doing is doing harm. So that's the importance of this toolkit. And I think that this is also a great time to highlight the school to clinic pipeline that we have in here in this toolkit, because that's a sort of a prominent feature of everything that we've been talking about. How the topic of using pronouns, different genders, recognizing those things are introduced in school, and in January's case, you have the school itself facilitating the students' gender transition and keeping those secrets from parents. So keeping this information from the parents, try in a manner that they truly believe is protecting the child. So using non-discrimination and child rights, I guess, types of language, and social emotional development types of languages, and then steering children towards a medical pathway. So that's what when you see our school to clinic pipeline, that's what we're talking about here.
Yeah, and I think, it's exactly what you said. It's a slippery slope. Everybody starts out with good intentions. For my whole career, I was like, oh yeah, great. Affirming sounds great. Affirming, kids. But really, I think there were subtle differences there in my early training. It was less about affirming and more about just, sort of trying to let the child go through a little journey on their own, and trying not to, because kids are naturally oppositional. And so, to some extent, we were sort of trying to let children work through things. And in my whole career, what I saw is what we were previously seeing, and what I think the evidence still bears out, is that most children, if they are not aggressively medicalized, this is a phase that they go through. And again, it used to be much fewer children than it is now, but this would be a phase that they would go through that would often resolve with puberty. I think that's really what the good science, the good papers still often show. But these things sound very benign, but then I know all the pediatricians I know, like, it sounds great to let a kid choose their name and pronouns, but pediatricians themselves, even with sort of all the narratives that are going on, they're like, wait a minute, they have concerns about the aggressive medicalization too, even with all the stuff that they're being fed that they're supposed to think on that. Their common sense is kicking in, especially for those who've been in practice for a long time, and they are starting to ask questions. So, I do have hope for the AAP and other professional organizations. One of my favorite examples is like the peanut allergy thing we got totally wrong. We told people to avoid peanuts for 3 years. We actually did a lot of harm, not on purpose, but we did a lot of harm, creating a lot of peanut allergy. And you know what? We accumulated the evidence, and to the AAP's credit, they reversed course. They were like, this is wrong. We're going to change these guidelines. And so I'm hoping to see the same trajectory in terms of care of gender dysphoria, because I think, unfortunately, we're in a place now where we are doing significant harm with the medicalization aspect, not to mention the surgeries. And I really hope to see a reversal of course here.
Well, I'm glad you're optimistic about that, but in the meantime, parents do need this toolkit and educators and
absolutely.
everybody in the community. So I'd love to hear from Dr. Kalibi, who's child and adolescent psychiatrist. Why do you think this toolkit is necessary?
Well, I think we've just heard many reasons why it's necessary. I mean, for one, to continue the school to clinic pipeline discussion, we have to realize, and I started medical school in 1995, until I moved from Louisiana and Florida in 2016, I saw 0 patients with gender dysphoria. 0 patients. I worked with psychologists. I worked with social workers. I worked with pediatricians. I worked with family practice docs. No one ever brought me a patient for consultation regarding gender dysphoria all that time. We have now created gender dysphoria, and you just put up the slides and everyone can see when you start planting these ideas in kids' heads at a young age, and children are suggestible. Younger children are more suggestible. Children with emotional and neurocognitive problems are more suggestible. And so when you're telling kids that it's perfectly fine and normal for them to feel distress about which sex they are and their sex body, well, what did we think was going to happen? I mean, this is the logical and conclusion to it. And the reality is, it's framed like this gender dysphoria is magically erupting from inside the child, when in fact it's being socially and ideologically pushed on the child. And when the reasonable people, like we did in Florida, say, hey, hold on, let's pass a law so we stop pushing this stuff, then people are saying you're a transphobe and you're a hater and so this is now how this discussion has become, unfortunately. And so the whole stigmatization of those who have a nuanced, rational, and cautious approach is part of what has gone on in the professional organizations. And therefore, the people at the top who frankly do not have a nuanced, science-based or rational approach have been leading other professionals. I mean, when the pediatricians and the psychiatrists are saying, oh, affirmation is a great idea. Well, if you're a social worker at a school and you see these people who are in theory the experts telling you, and then your schooling is telling you, and then your professional organizations are also telling you this thing of affirmation, which is totally different than everything else we ever do in mental health. There's no other condition where we do this, but in this one condition, throw out everything you ever learned and everything you know about child development and everything you know about cognitive therapy and what works in mental health, and we're going to do this different affirmation thing. So it is that crazy, the road that we've gone down. And it is perfectly, you can step back and analyze and just see it's applied common sense that we have to change course on this. And this is insane, and we're being led down a really bad path. The other thing I want to add that hasn't been mentioned is the lawsuits. So the ACLU and Lambda League and all this, they are ramming policy into schools through their lawsuits, because all they need to do is get one kid who comes and says, I'm not in the bathroom of my gender identity. And they'll come and start a lawsuit, and the schools don't want to fight it. And so we are getting bad policy in large part because of well-funded, ideologically driven lawsuits that are pushing schools into policies that no one at the school wants, and no one on the school board wants it, and none of the kids and none of the parents want it. So yeah, we have many layers to this problem, but people should just look at it, decide for themselves. But I'm pretty sure that almost everyone out there realizes that this doesn't make sense. We're doing harm, and you can't trust the quote unquote experts, the exact people who you shouldn't trust.
Yep. Thank you. So yeah, I agree that, and definitely the parallels to COVID are there, but I think both both of these examples, speak to a far deeper rooted problem in medical and science establishment, which has unfortunately made it necessary for us to speak directly to parents and educators and people who are not health professionals and scientists to go around that. And that is one of the reasons why this toolkit is necessary. The other reason I think this toolkit is necessary is something that Dr. Walsh brought up and Dana brought up, and is the language. You don't, your child comes home and says something to you, says the word pansexual, and you have no idea what that means. And so for me, hearing that from my own daughter coming home, I was like completely, one, caught off guard, two, I felt stupid. Like, as a pediatrician, how do I not know this? And I'm a doctor, how do I not know this term? But then when you realize how pervasive it is in every kind of cultural institution that's out there, on the social media, on the internet and other places, and in school, then that's when it's concerning. So for a lot of parents who just really don't know that this is happening, this is why this toolkit is necessary. For parents who don't understand the language and want to find out a little bit more, and not wade through a bunch of scientific papers and research, research or long books, then this toolkit is necessary too, because we define a lot of these terms. There's actually a glossary in the toolkit towards the very end that defines a lot of these terms. But I think we do a great job throughout the rest of the toolkit of also kind of explaining what some of these terms are. So what, and to me, I mean, that's one of sort of a common feature with a lot of the toolkits that are out there, but I think the way that ours is written and illustrated, I think makes it a lot easier for people to actually see and read, which is, I mean, it's really accessible. It's right there at your fingertips, and easily shareable. So this is the first page of the glossary of terms. Dr. Walsh.
Yeah, I was gonna go back for a second to the school to clinic pipeline. I mean,
Okay.
the glossary is amazing, but I just wanted to touch back on something Dr. Kalibi mentioned as well. And it's back to that slippery slope idea. Like, I know, I work in a clinic, we have a social worker in our clinic. I have worked with several school social workers. And like Dr. Kalibi said, like, these are people who really care about children. They want to do the right thing. And I think there are some scenarios in which, we do need school social workers to keep certain things confidential. Like if a child discloses abuse at home, or even something like sexual orientation, there's things that they either need to or should keep confidential. But however, we have had cases where schools have referred kids to medical clinics for gender dysphoria without the parents' knowledge. So I think that there's a huge divide there. It's one thing to, for school social workers to see kids with psychological distress. They do have guidelines where they do need to involve a parent, those were pre-existing. But it's a whole nother thing for schools to be sending kids to medical clinics without a parent's knowledge. So I think that the slippery slope is something we really have to pay attention to, whilst also acknowledging that school social workers do an important job. They do care about children. There is some confidentiality there that's important. It just doesn't extend to medical interventions that don't involve the parents in any way. I think most reasonable people would agree on that.
Yeah, absolutely. All right. Anybody else want to chime in on, what makes this tool?
Can I chime in something too that I forgot to mention? There's so much to talk about on the subject, but one thing that I want to make clear to everyone is that an approach that is nuanced and science-based and is against what's going on right now, against affirmation and against medicalization, this is a positive agenda for kids that are gender nonconforming. What we are doing now to the kids who are gender nonconforming is hostile to them. And in fact, many of the people who are fighting hardest against this are people who are adult, same-sex attracted, homosexual, gay, whatever, you know. So from this umbrella of people who realize that disproportionately kids, that if they were allowed to grow up, may have a difficult puberty and may have internal or externalized homophobia that they have to deal with, and that does make their life tougher. But they have a right to grow up as a full-fledged adult without being medicalized. And this is the compassionate route that we are offering. And the current route that's gender affirming is actually hurting kids that would end up, many of them, growing up to be same-sex attracted, and we're doing them harm. And I do think that that's part of how this all started, is because it came in under the umbrella of, we're going to help kids who are gender nonconforming, and we're going to help the, you know, LGBT community. But the T part, we have to realize, is that if people are going to transition as adults and they're fully formed adults, that's a whole nother thing that we're talking about. And that's not at all really what the school thing is about. But we shouldn't be calling children transgender children. This is an ideological term. Most kids who have gender dysphoria grow up and grow out of it. So that term right there should never be used. It's a really inappropriate term to use. And we have to realize that that this got pushed in because people realize that gender nonconforming kids have problems, and there's a lot of sympathies. And when this was all being introduced, it was under the guise of helping gender nonconforming kids, which everyone is really for. And so that's part of what happened. Once again, it was good intentions and a lot of ideology mixed together. But I think that nuance piece, you know, has to be out there, and people have to realize that we are actually pro gender nonconforming kids by not medicalizing them and by not affirming them.
Yeah. Awesome.
Yeah, like getting back to the whole puberty thing, like it's actually a huge, it gets sort of whitewashed as like, oh, it's just a pause button. You know, the puberty blocker drugs just put a pause while the kids can make a final decision. And meanwhile, we know that 96%, I think it is, of kids who start puberty blocking medications are passed right on to cross-sex hormones. And in the meantime, it's actually a huge medical intervention to stop puberty. And I think that some of this is coming out now with the lowered IQ points. We have no idea the permanency of that. We do know that when you artificially medically pause puberty for years at a time, there are permanent medical effects. I don't know why we wouldn't just assume those were also going to be affecting the brain, because we all know how much cognitive change occurs during puberty. And, you know, hormones really do dictate a lot of that growth. It's not just growth of the body, it's growth of the mind. So to me as a pediatrician, like there are huge and scary medical implications for just saying, hey, we're going to just try to shut down, you know, not do this whole period of growth that, you know, Mother Nature has allocated for humans for hundreds of thousands of years. And we're just going to hope that everything goes fine with that. And I think now some of the data is coming out, apart from the bone density issues, apart from the fertility issues. I think now there's cognitive issues that are coming out. And of course, we're not seeing much coverage in legacy media or certain medical journals, but I don't think I don't think they're going to be able to keep it quiet for too long. I think that it's just really going to become more and more apparent that medically speaking, this is pretty much a terrible idea.
January, I'm going to let you chime in here, and then I'm going to go to an audience question.
Okay, great. Just wanted to make a comment about something Dr. Walsh said. I think we need to be very, very careful when we start introducing the idea of abuse, because that term has been weaponized against parents like me. And so when I continue to ask for legal justification that the school was using to be able to meet with our 13-year-old daughter without our knowledge or consent and do this social transition, which is, you know, as you point out in the guide, is the school to clinic line. That is a psychotherapeutic intervention the schools are grossly unqualified to be doing. So, you know, all 50 states have very clear mandatory reporting laws, and rightly so. But you have to understand, teachers and administrators were being manipulated into believing that it was dangerous to inform a parent if a child was struggling. And in these LGBTQ guides that were found in schools all over Florida, it even explicitly stated that it could make them abused or homeless. So what you had was this false narrative being pushed. And I work with parents all over the country. I can tell you firsthand, these parents are not going to abuse their children, kick them out of their home. They just want to be notified if their child is struggling. So, suicidality has been weaponized, and so has the issue of abuse. So I just want to make that critical point, because there are a lot of parents in my situation who, like me, did not affirm the false identity because we saw a pathway where that was going to lead our child, and we felt that was a very harmful pathway. But you have states like California and Child Protective Services now removing children
Yep.
from parents who don't want to affirm these lies, place their child on a medical pathway. So we are in a very critical and scary time when it comes to parental rights in this area of medicine.
Yeah, that actually, your example about California is a great segue into the audience question. Amber West asked, laws in Colorado allow a 12-year-old to make mental health decisions when which I worry can lead them to medicalization before their brains formed. Is there anything in the toolkit addressing this situation? And Dr. Walsh, you touched on, this alteration of brain development with hormones and hormone suppression, and introducing new hormones at God knows what levels or that we're seeing. So yes, we actually do address this in the toolkit, Amber. I'm showing the page. It is on page 31. We talk about the adverse effects of puberty blockers. A lot of this information comes from published data. You may be aware of England's CAS review that was just published in April. It goes through, there's one of the large systemic reviews that it did was specifically on the effects of puberty blockers. But there's lots of adverse effects that are not being discussed. Parents aren't informed about before they start and agree and consent to treatments such as puberty blockers. And then there is a recent literature review here, if you can see where the pointer is, from the UK, found that there is evidence of detrimental impact of pubertal suppression on IQ. And so yeah, we're still learning about some of these side effects, but they are there. And part of our concern is the reluctance to report these side effects of these medical treatments of gender affirmation. But I want to go back. We sort of skipped, we skipped a little, we talked about the school to clinic pipeline, but and then sort of getting to the medical pathway. But can we go back and talk about social transition, and then what that means at different developmental ages? Dr. Kalibi, can you comment on that?
Yeah, social transition is, for those who are unclear what we're talking about, social transition is allowing a child to transition to their gender identity. So you could change your name, you could change how you dress, people could call you by different pronouns. So there has been a movement to allow children to self-define what they want to be called and what gender they want to. Now we're down to those 50 different genders. So but typically this started as boys wanting to transition to girls, girls wanting to transition to boys. And it is clear that social transitioning is not a neutral act. It is actually a psychosocial treatment. And it's a pretty powerful treatment. And I think the flippant and casual social transition of a child, even if you look today at what I think are unhinged guidelines from WPATH, all of those places are like, you should go to a psychologist, you should have a workup, you should talk with a professional before you even consider social transition. So to me, it is insane that schools are initiating social transition, a powerful psychosocial treatment, and one that it seems clear and common sense will tell you is going to make you more likely to continue to be gender dysphoric. So if you want your child to continue to be gender dysphoric, social transition is a great idea. If that's not what you want, social transition is not a good idea. So most people, most of the time, presented with the facts about social transition, would decide not to socially transition their kids. Unfortunately, there's lots of pressures to social transition as if it had been scientifically determined that you're saving your child from suicide, and this is the only way that they're going to be a healthy person, is to live in this other gender identity. All these slogans and myths have been propagated about social transition. And what we can definitely say, kids who are socially transitioned tend to stay gender dysphoric longer. And it sort of embeds the gender dysphoria in the kids, and that becomes more of their identity. And that's why, for the most part, and maybe totally in kids, we shouldn't be doing it. But it is a popular thing to do, and unfortunately that we're kind of having to push back against social transition now, and restore some normalcy in our schools.
And
So
so
I have a question about that. So if gender dysphoria is a diagnosable mental health condition, it's a diagnosis. I'm wondering if there's any other mental health or physical health diagnoses that are assessed, treated, and a treatment plan put in place in school without parental intervention. Does that exist?
that's
Not as
a
far as I
great
know
question.
of. I don't believe so. Once again, it seems everything with gender dysphoria and transgender status seems to be treated 100% opposite or totally different than everything else. And
Because even a child that has ADHD, to get 15 extra minutes on an exam, you have to like bring the Magna Carta to
Yep.
get them to agree to do it. And then sometimes you have to hire an attorney or an advocate just to get that to happen for your child.
Yeah. And
And-
you also have to disclose a doctor's, note saying that they can take their medicine, or it's sort of an explanation for that. So you do need a physician's input. But that is an excellent point, Dana. I think that is a question that needs to be raised publicly as well, because where do you draw the line? And where do educators get their their degree in behavioral health,
They're not
that they
doctors.
can
They're not
that they
gonna
can
perform,
make this diagnosis.
they're
Well,
not
and-
going to perform an appendectomy in homeroom. So
Correct.
why would they be creating a 6-page gender transition plan
Yeah.
and keep it secret from a parent?
Yeah.
And it's
Well, and
actually
we-
even worse than that. I
Yeah.
mean, there's a huge piece of this that we haven't touched on that I personally actually just did a deep dive in myself, which is that a lot of these kids that are reporting gender dysphoria currently are neurodivergent. I think the
Yeah.
numbers from Great Britain's clinic were about
Yep.
40%, which is staggering. So these are kids with autism and ADHD, and I have done myself, like I said, a deep dive in how are we dealing with that. And currently we only have one center in the entire country that has any sort of specialization area in terms of neurodivergent kids with gender issues, and that's Children's National. And there's basically one child psychiatrist at Children's National who's sort of an expert on that. And what he has written is that we were speaking of, like, the fact that social transition is not always a benign thing. So for kids with autism and gender dysphoria, a lot of the times they do not want to do a social transition before they start medicalization. They are ticking off medical boxes before they're even willing to do a social transition. So it gets very murky. And I think that we have to be very, very careful. For example, you know, even like Dr. Kalibi was saying, WPATH has guidelines for special needs children and young adults. And the biggest provider of quote unquote gender care in the country, which is Planned Parenthood, isn't following them at all. You can be a special needs young adult, be 18 years old, zero parent involvement, go to a Planned Parenthood clinic and get a prescription for cross-sex hormones in 30 minutes. This has all been documented. So the biggest, you know, care provider for this in this country is basically practicing Wild West cowboy medicine. They're not following even the most aggressive guidelines, which are the WPATH guidelines, as Dr. Kalibi said.
Yeah, a really significant point here is that yes, there is definitely more to the story in just about every case here. And so, as Dr. Kalibi stated earlier, 78% of these kids will actually, you know, outgrow and, you know, not have gender dysphoria by the time they've gone through puberty. Many of these children, I think it's around 30%, do have autism spectrum disorder. But there's multiple other mental illnesses and other maybe medical and neurological problems that may be present in a child that will make them more likely to have gender dysphoria. And so giving the schools this ability to make a decision about a child's mental health based on the child just coming to you and telling you, you know, what their preferred pronouns and their sex is, or just how they're feeling, you know, for the last 5 minutes, is pretty much irresponsible. And then it also highlights, it reminds us to point out that there is no expert clinical consensus, even though lots of people have been told, our media states, a lot of the activist groups, political activist groups will state that there is a consensus, a scientific consensus, and the science is settled. I believe that was something that Glisson said. There really is no expert consensus on how to treat children with gender dysphoria. So it's not a consensus, and that so therefore the schools really shouldn't be pushing one form of treatment options over another without parental involvement, without knowing the child completely, and without a, you know, physician or psychologist or, you know, behavioral specialist input here. January, you have your hand raised. You don't have to raise your hand, just chime in.
Thank you. Well, I just wanted to say there's a couple of other things at play here that we haven't really discussed. And I completely agree with Dr. Kalibi and Dr. Walsh that social transition is not a benign intervention. It's the first step toward medical transition. Yeah. So that's a really important point when we're talking about the school to clinic pipeline. So you also have to understand, if you look on page 17 of the guide, even this idea, this theory of gender identity is being pushed as if it is fact, is being pushed as if there is a biological component. Because when you historically look at all of this, we saw this as a very clear mental health issue that should be treated with mental health counseling. This has been so normalized, and now activists are even pushing the notion that this is not a mental health issue at all, that this is a normal variation of one's gender, and there's nothing wrong with irreversibly changing a child's body. I mean, this is how this has been sold. If you look back in 2016, this is when we started seeing a lot of documentaries about a, quote, transgender child. Well, that implies that that child was born that way. When you really start to scrutinize, well, what does that mean? Child's born in the wrong body? There is no evidence for this. And then you also look at gender theory itself. You cannot claim that something is an internal feeling that can change over time, such as gender fluidity, then also claim there's a biological component. That's why I think it's very dangerous when we're using even the term that a child is transgender. That's why I use trans identification, because it implies that that's who that child is, like it's a permanent state. And that is just not the case. It's not what the evidence is showing. And parents have to understand that the notion of gender identity is a theory cannot be objectively measured, yet we are now codifying this theory in law. You all mentioned in this guide about the Title IX changes that are coming. They're trying to replace sex with this idea of gender identity. And you can't protect both of these things at once. Those don't coexist. Because when you replace sex with gender identity, sex disappears.
Well, and I think it's very ironic that they are using in the primary school curriculum that book, I Am Jazz, because Jazz Jennings got what is billed as the perfect gender care, right? Like Jazz Jennings was, you know, puberty blockers for years, and then all the surgeries, cross-sex hormones, and that young person now is, I mean, anyone who's paying attention to her story, she's obese, you know, she's, I would assume infertile, but they've talked openly about her sexual dysfunction. And I mean, the idea that, getting back to that audience question we had, the idea that a 12-year-old can understand infertility, lifelong sexual dysfunction. I mean, I think any pediatrician would tell you that that is ludicrous to get a 12-year-old to understand what it's actually like to, you know, to never be a sexually functioning adult. You know, most 12-year-olds are still scoffing at the idea of probably still dating, much less having children of their own. They'll tell you, you're crazy, I don't ever want kids, most of them. And obviously that's not going to remain the case. So I do think we have to be very careful with these things. And if we're handing out books about Jazz Jennings, this is where we want all of our young people to end up. That's the goal here. I think that that's very troubling.
Yeah.
And I agree, Dr. Walsh. And Jax was pushed as a success story.
Yep.
Like, is that best case scenario simply because we can get a child to pass as the opposite sex? They determine a success. But as you pointed out, that person does not have any kind of sexual functioning now. Is this successful? And Jazz was operated on as a minor, by the way. So there is overwhelming evidence that not just double mastectomies are happening, which, by the way, the youngest patient to undergo a double mastectomy in the US is just 12 years old. There is no way a child that age can give informed consent for removing healthy body parts. And Dr. Etan Heim has said it best to me. He said the purpose of medicine is to cure disease or restore one's health.
Absolutely.
And these interventions do neither. They are actually placing the child into a state of disease and making them dependent upon lifelong medical interventions, which, as you pointed out, Nikki, we don't even know what the consequences of these interventions are. We're still learning as we go. They have been experimenting on these young people in real time. And I worry that the aftermath of all of this is going to be catastrophic when this next wave of regret comes over these young people, when their brains are fully developed and they fully understand what has been done to them and what the consequences that they will now live out are.
Yeah, can I just also say everyone that, and I don't follow the Jazz Jennings thing closely at all, and I never watched any of the shows, but I have seen a little bit of clips and some discussion, and I would just say everyone should imagine that in a regular, normal universe, this child would have grown up. And the most likely outcome is we would now have an adult, male, same-sex attracted, you know, adult, which would have been a perfectly fine outcome. There would have been nothing wrong with this outcome. And it does seem to me that people in the media, and in that case, you know, you had a mom who was very invested in a certain outcome. And it is medicine's and the system's job sometimes to push back against moms or other adults who are doing things that are not really in the best interest of the child. And it seems insane that this was, rather than pushing back and setting some appropriate limit on this, that this was celebrated and this was, you know, rewarded on so many levels. And so it just seems that that's emblematic of what has gone on in this, because there's the same thing on a minor social level that occurs every time a kid transitions in school, because it seems to me, and in talking with kids and talking with parents, if you're a gender non-conforming kid, and let's say a girlish boy or a boyish girl, you might be getting some flack for that. That might be a thing that's a little more difficult growing up. But then the day you say, hey, I'm transgender, now you're a star, now you're brave, now you're celebrated. Could we celebrate the girlish boys and the boyish girls a little bit and give them the support and the room they need to grow up and stop this? We only can celebrate you if you declare you're the other sex. It seems to be absolutely the wrong way to be handling this and is causing harm.
Yeah, and I think, I think January's point about, what the role of a physician is comes into play too with that. Our jobs are not only to restore health, but we're supposed to preserve it and and protect it. And so we should be allowing children to develop normally and support them as they are developing normally, and questioning your gender identity, your place in the world, your role as an adult human being, no matter what sex, are normal parts of human development. And even the youngest children will question where they are, or identify closely with either the same sex parent or the opposite sex parent at different points of their developmental stage. Most of the time, these stages of development aren't outwardly expressed to the degree that we are seeing, but we are seeing it expressed that way. And we should be telling young children that it's normal that you think that way. Like this is a normal part of your brain developing. Who knows what you'll be like when you grow up? And we should be, supporting their growth. And one of the things that the toolkit highlights is a couple of surveys that were done in 2023 that show that this is not a political issue. This is really, this is what everything that we're saying here about allowing children to develop normally as they normally would through their own physiology is what parents across the political ideological spectrum agree on. 78% of Democrats, Republicans, independents, all think that surgical sex changes should not be happening to children under 18 years old. And the vast majority also believe that puberty blocking medications and sex hormones should not be provided to children younger than 18. So we agree as a nation, but our public policy, medical organizations, and schools are saying the opposite.
Can I just quickly say that even that survey that says, should trans children get, is a misleading and artificially inflates those numbers. So those numbers are actually not reflecting a properly asked question.
Yeah, well, that's the other part of it too, is because that is the language that's propagating, that's part of the influence that we're seeing, is that that these political activists are changing the language and changing our use of the vocabulary around this particular subject, which makes the glossary and the toolkit be very helpful. Because I agree with you, Dr. Kalivi, that yes, no child is trans. Children have gender dysphoria, and then each child, there's a nuanced reason for for that diagnosis in each child, and we should be treating them accordingly.
Yeah, and I think one of the reasons that I really try hard to stay optimistic is that I think it's very important to try to recapture our medical institutions, all our institutions. I'm actually a Harvard graduate, and we saw we all saw the kerfuffle that happened there, and now they have an interim president there that's really working on viewpoint diversity among faculty so that people aren't canceled for even just being a certain political party. And I think that although I would say most pediatricians are modern and nuanced, there are activist pediatricians that go to into every exam room, trying sort of like like a religious leader wanting to convert as many people as possible. They are not the majority, but unfortunately, they are the people who often sometimes end up on these national committees making policy, not representative of the average, on the ground pediatricians that I know, of which I know many. So I do think it's very important for, medical professionals who are nuanced, who do have concerns, to make their voices heard, because I think they're the silent majority. But I think we have some very politicized squeaky wheels that are not only dictating policy, but trying very hard to cancel, censor, and even get their colleagues fired for having different opinions. And I think that, those of us who are more nuanced, the silent majority, has to start pushing back against our bullying colleagues who are really trying to sort of dictate the entire game and get everyone who disagrees with them canceled or fired.
And that's a great point that actually reminds me to talk about the third chapter or section of the toolkit, where we discuss what parents can actually do. So where do we want to go from here? We're arming you with this information. What do we want parents to get out of it and schools to get out of it? How do we want them to use this toolkit? And anybody chime in?
I can speak to that. I think I'm a very practical mom trying to get things in order. I'm Enneagram 1. I want to fix things. I think the biggest issue that you have is locally at your school board. School board makes the policy. For example, in New York State Department of Education released a 40-some-odd page document basically mandating that all school districts must have a written policy put in place for gender nonconforming children. Their recommendations was cut and paste from activist groups like Listen and GLAAD about gender ideology. Now, your big school districts like New York City, City of Buffalo, Syracuse, Rochester, those school districts cut and paste that, where the policy is to not tell the parent to socially transition the child in secret. And that is what they are doing in those cities. Now, in other school districts, they kind of make their own rules and policy based on who the school board is comprised of. In your more rural areas, you're probably going to have more reasonable policy. In your suburban and other urban areas, you're going to have policy that either says to keep secrets from parents, or policy said that maybe you should check with the kid to see if they think they still have a supportive environment at home. And these are the things you really need to dig into as a parent, because just because your school policy says that parents will be notified doesn't mean that that's actually what teachers are told to do. There's multiple instances of school districts near us where the policy looks good on paper, but when you talk to a teacher, they say, oh yeah, we're not allowed to say anything at parent-teacher conferences to ask a question about Johnny that wants to be called Jane. We're not allowed to.
Yeah.
When that's not actually policy.
And there is information very specific to this in the toolkit that teaches you how to figure out what your state policies are, what your local school district policies are, what your private school policies are. We go through this, and then what your rights are as a parent. We talk about that a lot. There are links, active links included for you to go to resource pages to learn more about these things as well. So if you download the toolkit online, you have really an excellent source of material right in front of you, and you're able to share that with other people too.
My question would be for Dr. Kalibi and for January, since you guys are in Florida, what would your ideal school policy be for gender nonconforming children and really state law as it relates to schools?
Yeah, I mean, I think for sure let's get ideology out of the young kids, school. So I think you could quibble about exactly what age, but I don't know why we would be teaching anything about gender identity or different identities to the really young kids. And I think you're trying to somehow get a balance between allowing a full range of discussion that's like developmentally appropriate in the later grades, and not supporting an ideology officially in the school. So I don't have a fine-tuned answer for that, so I'll hand it over to January, but that would be the sort of balance that you're trying to strike is, let's get it out of where the little kids are. It just doesn't have any place at all. And then in high school, you know, people are more sophisticated and the issues are more complex and the kids can handle more complex issues.
So how would you say parents should actually handle that scenario where they're seeing this in their, elementary school or or even their kids' high school? What actions can parents take?
Well, I mean, I think I have a probably very different perspective because I live this. And at the heart of a lot of this distress is real emotional pain. And for my daughter, it was a deep self-hatred that had been festering and manifested for a very long time. And so when you look at it from that standpoint, that what the schools are actually doing is not only destabilizing these children's identity and creating confusion where no previous confusion would have existed. So, they're creating the confusion, but then you're affirming that self-hatred. And so seeing that firsthand, I have a very different perspective. I don't believe that any of that should be in the schools at any grade level. Because again, it's being taught as if it is fact. They are not presenting another side. And this notion that we can't teach children to be kind to everybody, regardless of circumstances, is nonsense. I don't think any child should be bullied or harassed for any reason. But we can enforce anti-bullying and non-discrimination policies. And certainly children, to Dana's question, children should be able to self-express. This should have no, there's been so much conflation, not just with being gay and then this issue, but also gender nonconformity. They have all been wrapped in the same group and they are vastly different. But at the end of the day, I think what we all agree on is the medicalization aspect that is the most damaging and harmful thing that is happening with these young children. And none of these kids.
I hate to interrupt. You're making a fantastic point, but we're short on time, so we only have a couple minutes left. And I actually just want to get out of this, some advice for parents and what's in this toolkit that you think parents should do to help advocate for their child in school and other, and children in their community.
If you look on page 33, it's really important that if your schools have these policies that you push back, this whole page on opting out, Dr. Miriam Grossman has some great information on her website about opting out. And then if push comes to shove, we have seen success stories even in New York. If they are not respecting the parental rights and you're telling the school, this is not in my daughter's best interest, I want you to call her birth name and pronouns, make sure your parental rights are going to be honored. And if they aren't, we have seen parents have success in hiring an attorney, sending a demand letter along with, psychiatrist evidence of why this is not the best pathway for this child. Parents should be able to make these decisions for their own children. It should not be up to the child or the school because, like everyone has pointed out, the vast majority of these children either have co-occurring significant mental health issues or they're on the spectrum. And for that alone, these kids need time. It took about 2.5 years, but my daughter is completely free of confusion. I have families reaching out to me every month telling me my daughter's back, my son's back. They just, like you said, they needed healthy boundaries and time to work through this confusion. And sometimes they do need counseling to address that root issue, especially if it's something significant like trauma. But at schools, you must fight for your parental rights, find like-minded parents, and sunlight is the best disinfectant. Go to the school board meetings, point out why these policies are bad. Give the school board members this amazing toolkit and let them know this is the truth, this is evidence-based. The US and how we are approaching this is now an outlier compared to every single other Western country.
Perfect.
And
Thank you.
if I could add
that
in,
is
so
a
I'd say
great. Closing
The-
statements.
the-
For people watching, remember that you can get the toolkit at gendertoolkit.com. And you can, if you want to support FAIR, we run on donations, and we'd love to, have your support. You can join to get more information with newsletters by going to fairforall.org. And you can also donate to the cause using that same web address where and you can donate to Fair in Medicine specifically, or you can donate to other any other services that FAIR offers. So thank you so much for tuning in, joining us today. Thank you, Amber, for answering your question. My panelists, you are awesome. I mean, we could do this for another, several hours. And I feel like I really hate to cut everybody off, but we are the time is actually gonna stop. You guys did awesome. I mean, this was an amazing experience. I think it was great. Download the toolkit, share the toolkit, and that's it. Have a great day. Please. Oh, and like and share this video on YouTube once it's actually published, and then to make sure other people get out and learn about this toolkit.